Section 8. Dissociative Disorders. 1. Blank are marked by disruption of the fundamental aspects of waking consciousness and the general experience and perception of oneself. A. Perception disorders. B. Dissociative disorders. C. Disruptive disorders. D. Reserve consciousness disorder. The correct answer is B. Dissociative disorders. 2. The patient uses blank as an unconscious defense mechanism to separate anxiety-provoking feelings and thoughts from the conscious mind. A. Hypnosis. B. Dissociation. C. Relaxation techniques. D. Hallucination. The correct answer is B. Dissociation. 3. Which of the following is a normal type of dissociation? A. Daydreams. B. Highway hypnosis. C. Getting lost in a book. D. All of the above. The correct answer is D. All of the above. 4. Which of the following is a type of dissociative disorder? A. Depersonalization disorder. B. Dissociative amnesia. C. Dissociative fugue. D. All of the above. The correct answer is D. All of the above. 5. Blank alters the experience and perception of oneself. A. Dissociative amnesia. B. Depersonalization disorder. C. Dissociative fugue. D. Dissociative identity disorder. The correct answer is B. Depersonalization disorder. 6. Blank occurs in dissociative disorders. A. Pathologic dissociation. B. Derivative dissociation. C. Hypnosis. D. Reverse perception. The correct answer is A. Pathologic dissociation. 7. Dissociative amnesia affects mainly blank. A. Identity. B. Memory. C. Personality. D. All of the above. The correct answer is C. Personality. 8. Which of the following is true about dissociative disorders? A. It is common among the general population. B. It affects both males and females equally. C. Symptoms may arise gradually or suddenly. D. It affects more males than females. The correct answer is C. Symptoms may arise gradually or suddenly. 9. According to blank, dissociative disorders are a response to severe trauma or abuse. A. Learning theory. B. Psychological theory. C. Biological theory. D. Psychiatric theory. The correct answer is B. Psychological theory. 10. According to blank, the patient tries to repress the unpleasant experience in order to cope with the trauma. A. Repressive theory. B. Psychological theory. D. Biological theory. D. All of the above. The correct answer is B. Psychological theory. 11. Which of the following is the most closely linked with depersonalization disorder? A. Biological theories. B. Psychological theories. C. Learning theory. D. Repressive theory. The correct answer is A. Biological theories. 12. According to blank, dissociative disorders represent a learned response to avoiding stress and anxiety. A. Learned theory. B. Developmental theory. C. Behavioral theory. D. Psychological theory. The correct answer is A. Learned theory. 13. Which of the following is true about dissociation? A. A person who experiences dissociation after a traumatic event can consciously control the dissociation. B. People in dissociative fugue state behave in a confused manner. C. Dissociation is a poorly understood phenomenon. D. A dissociative disorder cannot mimic a psychiatric disorder. The correct answer is C. Dissociation is a poorly understood phenomenon. 14. Patients with dissociative disorder may be evaluated on which of the following diagnostic tools? A. Dissociative experience scale. B. Dissociative disorder interview schedule. C. Structured clinical interview. D. All of the above. The correct answer is D. All of the above. 15. Blank is used by art therapists to aid diagnosis of dissociative disorder. A. Structured drawing series. B. Diagnostic drawing series. C. Clinical drawing series. D. Dissociative drawing series. The correct answer is B. Diagnostic drawing series. 16. Blank is a highly structured interview used to diagnose trauma-related disorders. A. Structured clinical interview for dissociative disorder. B. Dissociative disorder interview schedule. C. Dissociative experience interview. D. Diagnostic interview. The correct answer is B. Dissociative disorder interview schedule. 17. Blank is a semi-structured interview which assesses the nature and severity of dissociative symptoms. A. Diagnostic review interview. B. Dissociative disorder interview schedule. C. Structured clinical interview for dissociative disorder. D. Dissociative experience interview. The correct answer is C. Structured clinical interview for dissociative disorder. 18. The structured clinical interview for dissociative disorder assesses which of the following dissociative symptoms? A. Amnesia. B. Depersonalization. C. Identity confusion. D. All of the above. The correct answer is D. All of the above. 19. Blank is marked by a persistent or recurrent feeling that one is detached from one's own mental processes or body. A. Identity alteration. B. Depersonalization. C. Derealization. D. All of the above. The correct answer is B. Depersonalization. 20. During episodes of blank, self-awareness is altered or lost completely. A. Identity confusion. B. Depersonalization. C. Identity alteration. D. Derealization. The correct answer is B. Depersonalization. 21. Blank is the third most common psychiatric symptom. A. Amnesia. B. Depression. C. Depersonalization. D. Identity alteration. The correct answer is C. Depersonalization. 22. Which of the following is not true about depersonalization disorder? A. Its exact cause is unknown. B. Onset is gradual. C. The symptom of the disorder has lasting effects. D. The disorder itself is not a chronic illness. The correct answer is A. Its exact cause is unknown. 23. Which of the following is a factor linked to the development of depersonalization? A. Sensory deprivation. B. History of substance abuse. C. History of mental abuse. D. All of the above. The correct answer is D. All of the above. 24. Which of the following is a sign of depersonalization disorder? A. Depression. B. Anxiety. C. Slow recall. D. All of the above. The correct answer is D. All of the above. 25. If depersonalization is linked to a traumatic event, which of the following treatment will be appropriate? A. Cognitive therapy, B. Pharmacologic therapy, C. Psychotherapy, D. Hypnosis. The correct answer is C. Psychotherapy. 26. In blank, the patient is taught to use reality-based coping strategies instead of detaching herself from the situation. A. Cognitive behavioral therapy, B. Psychotherapy, C. Hypnosis, D. Relaxation therapy. The correct answer is B. Psychotherapy. 27. Which of the following nursing interventions is appropriate for a patient with depersonalization disorder? A. Establish a therapeutic relationship. B. Assist the patient in establishing supportive relationships. C. Help patient recognize and deal with anxiety-producing experiences. D. All of the above. The correct answer is D. All of the above. 28. The key feature of dissociative amnesia is the inability to blank. A. Think logically. B. Sleep. C. Remember. D. Forget trauma. The correct answer is C. Remember. 29. Patients with dissociative amnesia commonly forget which of the following information? A. Their name. B. House address. C. Close friends' names. D. All of the above. The correct answer is D. All of the above. 30. Dissociative amnesia occurs in blank main types. A3, B4, C5, D6. The correct answer is C5. 31. In blank, the patient can recall some, but not all of the events during a circumscribed period. A. Continuous amnesia. B. Selective amnesia. C. Lapsed amnesia. D. Localized amnesia. The correct answer is B. Selective amnesia. 32. In blank, the patient can't remember events that took place during a specific period of time. A. Localized amnesia. B. Continuous amnesia. C. Generalized amnesia. D. Behavioral amnesia. The correct answer is A. Localized amnesia. 33. In blank, the patient forgets all events from a given time forward to the present. A. Total amnesia. B. Continuous amnesia. C. Selective amnesia. D. Localized amnesia. The correct answer is B. Continuous amnesia. 34. In blank, the patient's memory loss is limited to a specific type of information. A. Limited amnesia. B. Specific amnesia. C. Systematized amnesia. D. Selective amnesia. The correct answer is C. Systematized amnesia. 35. In blank, the patient suffers prolonged loss of memory, possibly encompassing an entire lifetime. A. Generalized amnesia. B. Systematic amnesia. C. Localized amnesia. D. Selective amnesia. The correct answer is A. Generalized amnesia. 36. Which of the following amnesia does not result from organic disorder? A. Dissociative amnesia. B. Displaced amnesia. C. Prevalent amnesia. D. All of the above. The correct answer is A. Dissociative amnesia. 37. Which of the following is not true about dissociative amnesia? A. The prevalence is unknown. B. It is most common in the elderly. C. It may resolve quickly, but sometimes become chronic. D. It does not result from organic disorder. The correct answer is B. It is most common in the elderly. 38. Which of the following is a factor that may contribute to the development of dissociative disorder? A. Altered identity. B. Low self-esteem. C. history of a traumatic event. D, all of the above. The correct answer is D, all of the above. 39. Which of the following is a symptom of an amnesiac episode? A, wandering aimlessly. B, aggressiveness. C, continuous fidgeting. D, facial tics. The correct answer is A, wandering aimlessly. 40. Blank aims to help patients recognize the traumatic event that triggered the amnesia and the anxiety it has produced. A, biotherapy. B, psychotherapy. C, medication. D, all of the above. The correct answer is B, psychotherapy. 41. Which of the following is a technique used to elicit memories? A, hypnosis. B, guided imagery. C, free association. D, all of the above. The correct answer is D, all of the above. 42. Drugs used to treat dissociative amnesia may include which of the following? A, alprazolam. B, lorazepam. C, SSRIs. D, all of the above. The correct answer is D, all of the above. 43. Blank is marked by sudden, unexpected travel away from one's home or workplace, along with an inability to recall one's past and confusion about one's identity. A, personality alternation. B, dissociative fugue. C, dissociative amnesia. D, identity alternation. The correct answer is B, dissociative fugue. 44. Which of the following is true about dissociative fugue? A, it is rare. B, it has an estimated prevalence of 0.2%. C, age of onset varies. D, all of the above. The correct answer is D, all of the above. 45. Which of the following is a function of a fugue? A, to represent disguised wish fulfillment. B, protect patient from suicidal impulses. C, reduce patient's exposure to hazard. D, all of the above. The correct answer is D, all of the above. 46. Blank may be used to prompt the patient to recall events and feelings. A, cognitive therapy. B, group therapy. C, hypnosis. D, behavioral therapy. The correct answer is C, hypnosis. 47. Blank may provide ongoing support and can help the patient gain self-esteem. A, group therapy. B, family therapy. C, cognitive therapy. D, hypnosis. The correct answer is A, group therapy. 48. Blank was formerly called multiple personality disorder. A, identity alteration. B, dissociative identity disorder. C, identity misrepresentation. D, dissociative fugue. The correct answer is B, dissociative identity disorder. 49. Which of the following is the most severe type of dissociative disorder? A, dissociative fugue. B, identity alteration. C, dissociative identity disorder. D, depersonalization. The correct answer is C, dissociative identity disorder. 50. Which of the following is true about dissociative identity disorder? A, estimate of prevalence range from 1 in 5,000 to 1 in 50,000 persons in America. B, it occurs in both men and women equally. C, it tends to be chronic. D, all of the above. The correct answer is C, it tends to be chronic. 51. Which of the following may cause multiple personalities disorder? A, severe child abuse. B, trauma. C, extreme stress. D, all of the above. The correct answer is D, all of the above. 52. All of the following are symptoms of dissociative identity disorder except A, continuous tics, B, sleep disorder, C, eating disorder, D, substance abuse. The correct answer is A, continuous tics. 53. Which of the following can be misdiagnosed as dissociative identity disorder? A, schizophrenia, B, Tourette syndrome, C, autistic disorder, D, social phobia. The correct answer is A, schizophrenia. 54. Which of the following tests can be used to diagnose dissociative identity disorder? A, diagnostic drawing test, B, dissociative experience scale, C, dissociative disorder interview, D, all of the above. The correct answer is D, all of the above. 55. Treatment of dissociative identity disorder takes blank. A, 2 to 3 months, B, 6 to 10 months, C, 1 to 5 years, D, 5 years or more. The correct answer is D, 5 years or more. 56. The goal of the treatment is to blank. A, remove the other personalities. B, integrate the other personalities. C, stabilize the other personalities. D, all of the above. The correct answer is B, integrate the other personalities. 57. Hypnosis may be used for which of the following purposes? A, to help the patient revisit the traumatic experience. B, to manage crises. C, to strengthen patient's ego. D, all of the above. The correct answer is D, all of the above. 58. Which of the following treatment is controversial in the treatment of dissociative identity disorder? A, cognitive behavior therapy, B, electroconvulsive therapy, C, hypnosis, D, pharmacological therapy. The correct answer is C, hypnosis.